Hey everybody, it's Melanie again, and today I wanted to do just a quick video to talk about the duodenal switch and why it's so rare. One of the things is that to be a qualified duodenal switch surgeon, that surgeon has to do training above and beyond, well above and beyond normal training to be a bariatric surgeon. They need to train for years with another surgeon who is qualified and who is very comfortable with doing the duodenal switch. It's almost kind of like an apprenticeship that they need to do to be well versed in the procedure. So that's additional training that, some doctors just don't want to take the extra step. So that's not something that they will offer to their patients as an option. Another is, because of that training, surgeons just won't even mention it as an option. And there are so few surgeons across the U.S. who offer the duodenal switch procedure. It's a long procedure for somebody who's not really skilled at it. It takes, I think, about 4 hours to do it. My doctor has perfected it to the point where he can do it, knock it out in like an hour and a half, thereabouts. There are also some surgeons now who are doing it robotically assisted. I know there's one excellent surgeon at Duke in North Carolina. His name is Dr. Sudan, and he does it robotically. And of course, now with the procedure being done laparoscopically, they don't have to slit you open except in very rare situations. That also helps with streamlining the time of it. But novice surgeons, it still takes them a long time. So if you do the math, where he might be able to operate on a couple of DS patients in a day, he can knock out 4 or 5 VSG or Roux-en-Y patients, or even more lap band patients. So if you do the math, you can kick out more people, you can make more money that way. That's also another reason why there aren't as many DS patients that you see, because the cost is higher. With the insurance, of course, that helps, but if you're a cash pay patient, you can be looking somewhere in the neighborhood of $25,000 to $30,000 or even more, depending on what part of the country you're in. If you go out of the country, I think in Mexico and Brazil, it's a little cheaper, but then you have travel costs plus the cost if there's any complications, or if you have any kind of malnutrition issues or need any kind of follow-up. It can be difficult to find a doctor here that might follow you if you happen to have any problems after the surgery. You find not as many duodenal switch patients because it is such a commitment to have the surgery. If you're not willing to commit to lifetime vitamins like you saw in my vitamin video, then the DS surgery is not for you. If you're not willing to stay on top of your diet and avoid some of the carbs, then you can really be in some situations later on down the line. There are a lot of misconceptions about the duodenal switch surgery. There are people going, "You mean that old thing? You mean they're still doing that?" And they have it confused with an older procedure called the jejunal bypass, or some people call it the JIB. That's an older procedure. It's not performed anymore because there were lots of medical problems associated with that. Liver damage, liver problems, kidney problems, just lots of different things that were going wrong for people that had the jejunal bypass. So that procedure isn't done anymore. The duodenal switch procedure in its current form has been around since the 80s. It was perfected, the current method perfected by a Dr. Hess and it involves measuring out the patient's entire small intestine and then making the incisions based on a percentage of that length. So no two procedures are the same. Each person's internal measurements are different. So the doctor has to know about that, and it's not a cookie cutter procedure. It's not like the VSG where you just insert the thing and cut it according to the little thing that they insert, and everybody's pretty much the same. And then it's not with the Roux-en-Y where you make the little pouch and then do a blind bypass of the leftover stomach and just go a little bit below that to make the Y. Again, those are pretty standardized procedures. The duodenal switch is not standardized. Each person's anatomy and each person's procedure is different. The cost, like I said, can be high, and one of the reasons it can be high is because there are so few surgeons who do the surgery, and since there are so few, your choices are limited and they can kind of charge what they want. But costs are coming down. More insurances are covering bariatric surgery, and duodenal switch is certainly becoming an option for more and more people. As I said, with the commitments, patients have to be willing to commit to lifetime vitamins. They have to commit to having their labs done every year, and really would be better to have them done every 6 months. And you have to stay on top of that and monitor those levels and commit to monitoring those levels and commit to having follow-up. If you're not willing to commit to that, then you're not an ideal candidate for the duodenal switch surgery. That's really about it as far as why the duodenal switch is so rare. It's just doctors have to make a big commitment, and patients have to make a big commitment too. And as a patient, you also need to research possible doctors if you're looking to have the duodenal switch surgery, because there are some doctors who say that they will do the DS and then they end up doing something different. Or you might find a person who says they're going to do the DS and you find out, well, they've only done like 5 or 6 surgeries. You want to research. There's a website called dsfacts.com, among others, and they have lists of doctors who have excellent reputations, who have proven surgical records, and who have been vetted to be reliable, trustworthy surgeons. So if you're interested in pursuing duodenal switch surgery, I highly, highly encourage you to study, research your doctor, look and see if they're vetted and well recommended, and look and see if they do follow up with you post-op on your nutrition. Ask them questions. I have a video on my playlist about an actual animation of the duodenal switch procedure. Look at websites that show it. When you talk to a surgeon, have them draw it out for you. They should be able to show you exactly what it is. And if they show you something different that makes a loop or something totally different than the standardized duodenal switch surgeries, then you need to find somebody else. Because duodenal switch works if you commit to it, but you've got to have somebody who's going to operate on you correctly and knows what they're doing and is experienced in it. So thanks a lot for watching. You guys are awesome. There's been a lot of new surgeries out there, and I'm just so proud of everybody and excited for you, and looking forward to getting there myself. And we'll see you soon. Thanks a lot, and sparkle on. I have my invisible tiara on today. Thanks.